Plastic deformation, also known as a bow fractures, was described in 1876 but then re-recognized in 1974, and it's only seen in children only. There is no obvious macroscopic fracture line or cortical discontinuity. Multiple microfractures are seen, usually can be associated with a torus fracture which can coexist, and most common clinical scenario is a plastically deformed ulna with a torus fracture of radius. This is how the plastic deformation takes place, and it springs back once the force is taken off. And in plastic, normally elasticity is like that, but when the plastic deformation takes place, when you apply a force, the bone becomes permanently deformed. This is the elastic deformation, and if you apply more force, this becomes a plastic deformation. This is the real life example. When you go on a bridge, suspension bridge, it's an elastic deformation, but when it breaks, it's a beyond plastic deformation, that's a fracture. So there is some literature on that, and 11 children followed up for 80 months, average 7 years, 5 months. Initial diagnosis was missed in 3. 9 patients, there was a residual curve which was expected, but in conclusion what they say is after 6 years there is hardly any remodeling in plastic deformation. So the recommendation of treatment is reduction under GA if the child is more than 6 years and there is a cosmetically unacceptable bowing deformity of more than 10 years. So let's look at this child who came with a bowing of the forearm like this, not very painful. On X-ray there was a radial fracture which was buccal in the shaft, and there was ulnar fracture which was bowing. The manipulation, you should do it over a large towel with a gentle force but over a longer period of time. This is how you will get overcorrection of the deformity. This is how is the final position. 7-year female, this is how she comes with bowing deformity. The lateral ulnar bowing is that, but exact deformity you will be able to judge only when you take a X-ray which is right angle to that. Manipulation, as described earlier, this is how you get a 1 week follow-up. Ulna has to be maintained in a cast which is straight. I think Shittal is going to take after that. Sometimes when it is not recognized and you get it after a couple of weeks, you can obviously see that there is a deformity and there is a rotational restriction, but this girl did not have any pain and she did not continue with me for treatment. So this 14-year-old, again treated on OPD basis, had a complete radial fracture and there was a plastic deformation of ulna. 3 months later, the orthopedic surgeon thought that it will remodel and was not remodeling, so he sent it to me, and I thought that I don't think it was going to say that. 6 months later, the ulna is still plastically deformed. So when you get your plastic deformation next time, if it is aesthetically or functionally unacceptable, then you should manipulate it under GA. You should not give strong force, but a gradual force over a longer period of time, over 2 to 3 minutes, will get the correction of the deformity. Thank you very much.